Hello, and welcome to It's Your Lymph, a podcast about all things immunity, health, beauty, and longevity. I'm your host, Lisa Levitt-Gainsler, and I've dedicated my entire career to working with people's lymphatic systems because the results are nothing short of astonishing. Come along as we reconnect to the flow of life and learn how to harness the power of lymph. So, hello everybody. Welcome to this episode of It's Your Lymph. My very special guest today is Dr. Kristi Funk. She's a renowned breast surgeon, best-selling author of Breasts, the Owner's Manual, which everybody needs to own, and advocate for breast cancer prevention. She founded the Pink Lotus Breast Center with her husband, where she provides personalized and compassionate care to those affected by breast cancer and serves the underprivileged community through their Pink Lotus Foundation. Dr. Funk is a leading expert in breast cancer prevention, and her innovative approach focuses on empowering patients with the knowledge and tools to reduce the risk of developing the disease. Musician Sheryl Crow wrote the intro to her book, Breasts, the Owner's Manual. She performed the actress Angelina Jolie's widely publicized double prophylactic mastectomy. She's appeared on The Doctors, Good Morning America, The View, Today, CNN, and more. And I know of your work with Everyday Women. We share clients in common whose lives you really help save. You have so much knowledge from the Western perspective, the holistic perspective, and you are so compassionate. And I'm just so happy you're here. So that was a big intro, but thank you so much for giving us your time.
Oh, it's my privilege. And thank you for the intro. And thank you for the incredible work that you do with our mutually shared patients and all patients that you work with. It's such a service and such a niche. Like, people really don't understand the lymphatic system the way you do. So
people don't understand. They only hear of lymph when, they're diagnosed with cancer. But before we begin, I have a couple icebreaker questions just to get us relaxed. Number one, my favorite question, what's your favorite place you've ever traveled?
Ooh, Costa Rica.
Oh, I love Costa Rica.
My husband had this whole plan, like a solo trip to Costa Rica planned, and we met, and then we went out on our first date, which became like every day thereafter, forever and ever, amen. But it was so we went out on a Saturday, and on Monday night we're sitting at dinner, and I said, oh yeah, in 2 weeks I'm going to Costa Rica for 3 weeks. And he was like, this whole place just went like, and I was like, I mean, it's just with me. You can come if you want. He's like, okay.
I love that.
And we went together, and it was just the most fabulous exploration of eco resorts and volcanoes and surfing, which I learned to do down there with him. It was the best trip ever.
This is why I love asking people where they travel. Travel is so important for joy and the soul and meaning. And okay, next. If your lymph could talk, what would it say?
Let me go.
Let me go.
Let me go. Let me flow. Let me keep moving. Let me do my thing. Don't get in my way.
I love that.
Don't stop me. Don't block me.
What do you think gets in the way of lymph? What do you think blocks it?
You know what? I think that the obvious answer from my perspective is surgical trauma, scar tissue, and damage to the lymphatic vessels themselves, coming not just from surgical trauma, but radiation can do that. And so can the toxicities of life when they build up too much. I mean, what is lymph but a toxicity channel? So it makes sense that injury could come from the inside outward toward the lymphatic walls.
All right, I got to break that down for a minute, Dr. Funk. You just opened a bomb, like a truth bomb here. I'm like, okay, we're digging in. So what do you say then to people, to your patients who need to have a lumpectomy, which is way more invasive than people believe? There, a lot of doctors are like, oh, it's just a needle biopsy, but that's scar tissue. Or they're going to have either a prophylactic mastectomy or they're going to have a double mastectomy and they need radiation. How do you help balance the trauma and the need for it?
Every cancer story in terms of the tumor biology is somewhat unique. I mean, there are categories, right? There are like 21 different subtypes of breast cancer. And so some are a more serious threat to your actual survival than others. So I think we do have to, I always temper that conversation of risk versus benefit to be exactly about that. Like, what is the risk of this particular cancer metastasizing and what are our options to treat it? And then what are the side effects and what's entailed with each of those treatments? So it's a thorough discussion and it varies so much by person to person in terms of, is this risk of fill in the blank worth the benefit of the cancer cure we're after? And do we have to do that to cure it? Like, I'm a huge proponent of not over treating cancer, which happens all day long, every day.
And what does that mean for you? I have my theory of what I think over-treating cancer is, but I'm curious what you think over-treating cancer is.
Over-treatment is aiming too many therapies at trying to cure a cancer that otherwise, without those therapies, would never have become a nuisance to this woman in her living lifetime. Like, maybe it will kill her when she's 212 years old, literally.
Then how do you know the difference?
You don't. And that's part of the problem, but we're getting a little bit better at genomics, at understanding the underlying drivers within a tumor that do have, some are, like, say, for example, mammoprint. This is a genetic analysis of 70 different markers for cancer recurrence. Some of these markers are good for a cancer to express. Some are bad. And so each mammoprint, the name is sort of like thumbprint, right? It's very unique to you, what this cancer of these 70 markers is doing and not doing. And so when you get this analysis on your tumor, you're basically getting your tumor's fingerprint and the percent chance that it will come back metastatic in the next 10 years, the chance that it really is driven by estrogen. So a lot of your listeners are going to be cancer thrivers, and 80% of them will have had or have breast cancers that are driven and fueled by estrogen. But estrogen is kind of like a light switch. That receptor may or may not be activating the tumor to grow and divide. We categorically treat them all as if they do. You have estrogen receptors, so we're going to block estrogen in your body. But what does that actually mean? Like, did you ever walk into a room in your house? We tend to go from least to least, and I'll inevitably find some rooms and I'll like flick the light switch and I'm like, what's this doing? Like, what is this one for? Like, nothing is going on. And that's how a number of estrogen receptors behave on tumors. There is no connection between the receptor on the outside and the cell function on the inside, and yet we treat those women as if it's all functional. So over treatment is doing too much, and we want to limit our plan to the things that are just absolutely necessary, and then use things like genomics to get after, like, okay, so another thing in our bucket of tools is anti-estrogen therapy. But what about your cancer? Let's dig into that. See if we really are going to benefit from anti-estrogen therapy, because hello, hot flashes, night sweats, vaginal dryness, mood swings, itchy skin, insomnia, irritability, maybe divorce. No, kidding, but it's no joke.
You know, it used to be like 30 years ago, it was like anyone who got breast cancer, it was like mastectomy and reconstruction. And I just have seen such a change in the past 5 years, really, of less move to mastectomy, but then how do you balance that? You know, if someone has the BRCA gene, having the prophylactic double mastectomy, but if somebody has the BRCA gene, they're at risk for a bunch of other cancers, and you're not going to just go removing body parts and skin and, you know, so I guess what would you say to people who know they have the gene? I also know that you have said, 87% of women diagnosed with breast cancer do not have a relative with breast cancer or a gene.
Absolutely. So you've touched on two of my favorite things to talk about. One of them is, how do we handle a high-risk woman who has an inherited gene mutation? And this truth that people are very seldomly actually know is that 5%, maybe 10% tops of all breast cancer is because of BRCA or one of these other inherited genetic mutations, CHEK2, PALB2, and the like, right?
5 to 10%. That is so small, right?
Very small. So 5 to 10% is a genetic mutation. I'll give a good 5%, not much more than that, to, wow, that is like truly random fate that I cannot explain. Like, you're only 32, there's no family history, you're completely zen since birth and vegan and exercise, and you're not fat, and you're like, it doesn't make sense. You haven't even lived badly enough, long enough to explain why this mutation would form and be present. And you don't even live badly, right? Like, that is so tragic to me, because I really don't have a good handle on the whys of that one, except this whole epigenetic reality, right? Which refers to the toxicities and environmental and other impacts of just the wear and tear on your body, because you're a living human, right? So you can't understand yet the very fragile interplay in some people between that. Like, why does the sun induce melanoma in some people and not others, right? So 5% though, usually the big fat bell curve in the middle of our two extremes, this is actually a beautiful thing to know. It's totally under your control. Every time you lift fork to mouth, every time you drink or don't drink something, every time you think or don't think something, every time you move or decide not to move, every decision that you're making in these big categories of life is moving you closer to cancer or farther away. You're choosing or you're not choosing, but you're doing. And it's happening, whether you know it or not, or you control it or not. But that's awesome. There's so much under your control in terms of, if you already have a diagnosis, of helping to slay those percent chances of a recurrence and improving your survival, because you can control the cellular bathtub that your little cells are sitting in. So more on that, I'm sure, later, but I just wanted to address that awesome fact that you brought up, that the vast majority of cancer is not from genetics, nor is it just random or from fate. It's from the things we do and breathe and eat and think. So
because we're here, let's just dig into that, because in your book, you do mention how women can decrease the risk of developing cancer and you share in your book, Breasts, the Owner's Manual, tips for people. So lay them out for us.
Okay. So when you think of the things that have the most impact on pushing you to or away from breast cancer, guess what? All of these same things, for the most part, are also driving you toward all of life's major killers: heart disease, stroke, diabetes, Alzheimer's, obesity, and not just those things that actually are in our top 10 of killing you, and all other cancers, by the way. They also help decrease the things that just steal you of joy and of purpose and of passion and of love in your life, because of irritable bowel syndrome, joint disease, depression, anxiety, rheumatoid arthritis, inflammatory conditions, autoimmune disorders. Like, all of these things are in this same solid 80% of my bell curve. So that's a beautiful thing to know, that you aren't just solely hyper-focused on this scale for the purposes of healthy breasts. It's just one awesome benefit. So what are these things that are on the scales, tipping you toward cancer or away, toward all diseases or away? There are boulders and there are pebbles. Why? Because of the weight they carry on the DNA inside your body, on the arterial walls, if we're thinking heart disease, right? So the boulders that matter the most, if you have a boulder, I kind of don't care about the pebbles because they're not going to tip the scale so much. Boulder number one, diet. So the boulder weighing you toward cancer will be heavy in animal fat and animal protein, away whole food, plant-based.
What do you say to the people who are like, protein is so important for the building blocks and the aminos of your muscles and your cells and like all these other things? Do you break down what types of animal proteins are okay or not okay? Are you saying all animal protein? Like, what do you think about that?
All animal protein is deleterious to your cells. All animal protein, every time you chew and swallow, even the happiest little muscle fibers of an organic cow that had 500 acres to itself, that ate only like human grade food, that piece of meat, although devoid of much of the GMO feed and the pesticides, and then from the foods, the insecticides, the antibiotics, and the hormone injection, all the other things that 94% of our cattle receive, even if you're eating that more pristine piece of meat, the automatic response inside your body with no help from you is going to be to elevate estrogen levels, to elevate IGF-1, insulin-like growth factor. Now, this is the big daddy growth promoter that's inside all of us all day. But your brain is super smart, tells your liver how much to make. This IGF-1 is responsible for the 50 billion cells we turn over every day. That's remarkable, right? 50 billion. The stomach cell lining, for example, you shed skin cells. Like, they all need replacing or we disintegrate by Christmas. So these cells get replaced thanks to IGF-1. But what if you have an excess? Well, it's just screaming at everything to grow fat, grow metastases, grow plaque. And that's exactly what it does. There are people in Ecuador who have Laron syndrome. They can't process IGF-1. They're all dwarfs. And No one in the history of the world with Laron syndrome has ever had breast cancer, or really any cancer ever, except one lady with ovarian. Yeah, in 2017, and she's still alive. It was stage 1. And jaw drop number 2, nobody with Laron syndrome has ever in the history of the world had type 2 diabetes. That is how integral to these two huge diseases, cancer and type 2 diabetes, IGF-1 is. And you just stoked it by chewing that meat. Number 3 thing you do with whatever animal product you're swallowing, increase angiogenesis. Angio, blood vessel, genesis, birth. The birth of new blood flow is a requirement for every cancer inside your body to form, persist.
Please define for people listening, what is angiogenesis? Important.
Angiogenesis, angio, blood vessel, genesis, birth. The birth of new blood flow is a requirement for every single cancer cell inside your body to initiate its formation, to propagate and proliferate, become more and more of itself in place, and then guess what else that blood vessel is? Boom! Exit strategy. Straight to the brain, straight to the bones, straight to the liver, out of the breast. Angiogenesis is perpetrated by eating animal protein and squelched by eating plants. So we've got elevated estrogen, elevated IGF-1, angiogenesis, and it's all culminating in this chronic inflammation, oxidative stress inside your body, which allows for immune system dysfunction. Now your one cell protector, you're the immune, there are a number of names for them, but they're there to scavenge out free radicals and to get rid of intruders or cells that have morphed in such a way that they're here to harm you now, right? They've got this little mastermind evil plan, a cancer does anyway, and your immune system can sense that and seek it out and destroy it. So you damage that when you're eating too much or any animal protein, and eventually, year after year, decade after decade, there's just too much inflammation, oxidative stress, and in walks cell damage, mutations for cancer, arterial plaque buildup and inflammation in the walls for all the heart disease and stroke out there. So the interesting thing is that though animal protein does all of these hazardous things inside of your body, the equivalent amounts of plant protein not only don't do that, they reverse that. They lower estrogen, they lower IGF-1. It takes away the blood vessels that exist, anti-angiogenic, anti-inflammation, boosting your immune system, and even allowing the repair of mutated DNA. Plants are so powerful. They're their own little pharmacies, yeah.
So what are good examples of high protein plant food?
The two best are going to be seitan. If you don't know what that is, you can't have it if you're celiac or have a gluten sensitivity because it's just vital wheat gluten. But that puppy is packed with protein. A third of a cup has 18 grams. It's got this firmness, texture to it. It's pretty much tasteless, so it's all about the seasoning and how you can just fry it in a pan or bake it in the oven. But it's delicious. It's like a really great, like the vegan world, we love seitan.
Yeah, I love it. Yeah.
Really, right? And then tofu. The whole world of soy is phenomenal.
What do you think about tofu and high estrogen for breast cancer patients?
So I understand what the concern was, and let me address it. Especially, I think this was my concern. So I was a breast cancer surgeon in private practice for 18 years, telling everybody to spit the miso out of their mouths. I am so sorry. If you were my patient, I'm embarrassed by that, but sorry.
That was what people thought and said. I mean, even in the lymphatic community, there's things that we do differently now than we did 20 years ago, 10 years ago.
So live and learn. And I'm proud to be able to say, like, oops, sorry, I was wrong. But guess what? I'm not a pendulum swinging. It's not, oops, sorry, I was wrong. And then in 5 years, I'm like, oops, sorry again, soy's bad. Oops, sorry again, soy's good. This is what happened. I was fed misinformation, or we didn't have complete information. And now I have the real deal human studies, randomized controlled studies, or big population studies in humans following breast cancer incidence, recurrence, and death, and comparing high versus low soy consumption. Like gold standard to get me to tell you what is truly true. What was my standard before? Two things. One was the knowledge, correct knowledge, that soy in any of its more healthful forms. So in the fermented world, you got tempeh, miso, natto, tamari. In a minimally processed way, soybeans, edamame, tofu, soy milk. The only thing to shy away from is soy protein isolate, and we can talk about that, but it's really just found in your fake vegan meats and in some powder, protein powder things. And it's not deleterious, it just has no benefit. Anyway, so it's really everything else that's with it, like with that burger, which is a lot of oils and blah, blah, blah. Okay, back to the reasons why I thought soy was so bad. There are isoflavones in soy. The highest amounts are called genistein and daidzein, and they're in soy acting like estrogen. They have the very similar chemical structure, phytoestrogen, plant-based estrogen. So I would tell people, like, lady, your tumor loves estrogen. It's fueled by, like, how much do you love soy? Just, no soy for you, because estrogen, phytoestrogen, this thing isn't discriminating. It doesn't care if it came from your ovary or horse urine, which is what Premarin is from, or a soybean. Like, no, you can't. It's going to fuel the cancer. And I did it out of, love and concern. So that was number one. Number two were these poor little mice. I'm against animal studies in medicine. There are computerized models and better ways of proving everything we do, but there have been so many, I'm not going to not learn the lessons that they taught us.
Right. I love that. Great attitude.
So mice were grafted with breast cancers and fed soy, and all the cancer grew. Okay, I'm done. Like, there's no soy for you. That was it. That was the end of my self-teaching. I never thought about soy again, to be honest. I didn't revisit the literature. I had my evidence and I was done with soy. Actually, it was 17 years that I spewed that nonsense. Whoopsies. Because then I went to write Breast, the Owner's Manual. Being grateful that you've mentioned a couple times, because I'm really proud of the birth of my fourth child there in that book. When I went into the science to prove with fact that, in fact, you should spit the miso out of your mouth. So blown away by the rock solid human evidence that shows every single human study ever done, which, in my subtle defense that's not very strong, hadn't come out even until 2009. That's when they all started tumbling out. So it's not like ancient history, but it's been 15 years. It's time to know this, people. Every human study looking at soy and breast cancer shows a between 25 and 60% drop in occurrence, recurrence. So even if you have an estrogen-driven cancer, there's a solid 32% drop in recurrence and 30 to 60% drop in death for high versus low soy consumption. Two facts about the high consumers in many of these studies. Some of them are literally half a serving of soy a week. And I add,
wow, only a week. Wow. Okay, that's good. That's good to know, Pete. That's easy to do.
2 to 3 servings a day of soy is going to maximally benefit you. And the other thing that often people still give soy a bad rap about is just other side effects, like with thyroid dysfunction, endocrine disorders, prostate cancer, and semen levels in men, little man boobs, which I properly call gynecomastia, menstruation interference. So Dr. Messina et al. Came out with a really beautiful 2021 review of 417 human, again, not got rid of the mice, human studies and soy, and definitively concluded that soy is not an endocrine disruptor. And it doesn't cause any of those things I just mentioned. It is such a safe superfood. Put it back in the fridge.
Amazing. All right. So that was a lot on animal protein and soy, which was one of my major questions. You were also starting to go through the list of other tips that people can do to help prevent or reduce the risk of cancer. So food.
The kind of protein list, though, was the seitan and soy. Beans, my gosh, there's so much protein. A can of beans, a cup of beans, not a can, a cup has 15 grams of protein and 15 grams of fiber. They're my favorite. Lentils, beans, peas, split peas, chickpeas, nuts, seeds. There are so many sources of protein. Even a cup of broccoli is going to have several grams. So plant-based eaters don't think twice about their protein. They don't count their grams. They don't have kwashiorkor, which is the medical term for protein insufficiency. And in fact, 97% of people, vegan and meat eaters alike, all get plenty and satisfactory amounts of protein. Ironically, 97% of people in the United States do not get the meager, wimpy recommendation of 25 to 30 grams of fiber a day. So if anybody everybody should be obsessing. It shouldn't be over protein. It should be over fiber. Okay, so that's the end of the protein conversation. The other things that are on our scale tipping us, so we have diet. The other huge one is being overweight or obese. So without a doubt, all studies, or many studies, not every single study is going to prove the same point, but they all show a very clear connection between being overweight or obese and breast cancer in postmenopausal ladies. Okay, so being overweight or obese has so many interesting, fascinating connections actually to the causation of breast cancer that goes well beyond just what people might think of as, oh, that must be the connection. So the first obvious, it's not even that obvious unless you're a doctor, and this is where most doctors think it all ends, but when you have fat, and then an excess amount of fat, everywhere there's a fat cell, there's an enzyme called aromatase, and it is converting pre-estrogen compounds that come out of your adrenal gland all day long. You're never going to lose your adrenals, so you're going to have androstenedione, testosterone, and some other steroid hormones that fat cells convert to estrogen. So, since we already know that 80% of breast cancers are fed and fueled by estrogen, do overweight women in fact have higher resting levels of estrogen? When you look at the postmenopausal ladies, because the ovary is like such an estrogen factory that it gives you these high levels anyway, and an overweight person isn't going to have like a higher level than that. Like the ovaries doesn't doing it all, right? So look at the postmenopausal ladies. And yes, in fact, the levels of estrogen pretty linearly correlate to more weight, more estrogen.
So is that why they give aromatase inhibitors to people with certain types of tumors and cancer, and that helps control what the fat cells are doing with the tumor? Or am I getting that wrong?
Oh, you're absolutely right. So there's a whole category of drug called aromatase inhibitors. Some of you watching might recognize the names of them: Femara, Letrozole, Arimidex, Aromacin. These drugs go out to the fat cells, shut the enzyme off. So without the enzyme functioning, if you're menopausal, you have no source of estrogen, except for the small amount you're going to be getting from your food, right? Like, when does a cow make milk? Same day you make milk, when you're pregnant or shortly thereafter and lactating. So all of your dairy products come from a highly estrogenic state from that cow or goat or wherever. And beware, it takes 10 pounds of milk to make 1 pound of cheese. So
dairy, for sure, dairy, cheese, no, huh?
No. Yeah, the dairy connection is a little bit more difficult to show. Like, I can pull out as many studies that show there's no connection between dairy and breast cancer as I can pull out ones that show a connection between that and causation, recurrence, mortality. So I can cherry pick literature, but the reality is it is very inflammatory. 85% of our African American and Latina sisters are lactose intolerant. And so just from a pure perspective of, I'm convinced that we were never designed to drink the milk of other animals. And the point of our breasts making milk for the nourishment of an infant is not harmful, because in those first months and couple years of life, their immune systems are developing, and it has everything to do with survival. So this is interesting, I think. The main protein in milk is casein, 80% of the protein. As soon as casein hits your stomach, it turns into a compound called casomorphin. And just like that sounds, straight to the morphine or opioid receptors in your brain telling you, give me more of that, right? So, and the reason why I haven't been able to ask God directly and get an answer, but it seems to make sense that if you're a deer giving birth to a little baby deer, you don't want it galloping off into the forest and getting eaten by a lion, so it stays close to mother because it wants more of that, right? So it's the exact same thing that happens in humans. When a new mom walks into the room and the baby's like, eyes locked.
Right. Oh my God. Right. I remember those days.
And you're like, oh my gosh, my son loves me so much. He doesn't. You're a drug dealer and it wants more of it.
Oh my God, amazing.
You can never eat one slice of pizza. You gotta have more. But they're like the LACE study, Life After Cancer Epidemiology study, is a really robust, like 12-year follow-up of many thousands of women. Shows a 56% increase in mortality for high versus low dairy product consumers. And it was a cup a day versus less than that a day. Like it wasn't even versus plant milk or something like that. So Fat is a little estrogen making factory. And in point of fact, if you are overweight or obese, you will find that those women have between 50 and 250% more cancer. And there's one fun study. It's fun for me to talk about when I'm in like live audiences because I'm like, okay, remember how much you weighed when you were in high school. Now how much do you weigh? Get the difference. If you are plus or minus 8 pounds from your high school weight, you're golden in terms of weight contributing to breast cancer risk. If you've gained between 8 and 13.9 pounds, just the weight alone has increased your risk of breast cancer by 25%. If you've gained 14 to 29 pounds, you've increased your breast cancer risk by 60%. And if you've gained more than 29 pounds since high school, you've essentially doubled your risk of breast cancer. So there's really no controversy around whether weight promotes cancer, but so far beyond that. So estrogen is not the whole story, and I think it's not even the main driver anymore now that we're just starting to uncover it. Like I have a number of studies between 2019 and now 23, like very, very recent, that are diving into the leptin connection. So leptin is produced and secreted into the circulation mainly by adipose, by fat tissue. And once leptin binds to its receptor, it crosstalks with all of these, they're called oncogenes, like the light switches that are pro-cancer, that go on. They can be turned off, but leptin just flips them on. So you got all of these oncogenes that ignite numerous signal pathways throughout the body that release pro-inflammatory molecules, right? Cytokines, growth factors. And the end game is basically breast cancer initiation, progression, and metastases, all because of leptin. The other thing about fat is this chronic inflammation that occurs. There's definitely, like, is there no, and that's why obese women have higher risks of lymphedema, right? I'm bringing it back to lymph. But chronic inflammation is going to promote that same sort of cancer growth and metastatic spread. It brings angiogenesis. There's my favorite word. It modifies immune responses. Like inflammation is just a bad actor. It just interferes. It interferes. This inflammation, which by the way is your baseline. When you have true obesity, you at a baseline, you can't get rid of it. You have this fat induced, it's just happening. It's like exhaust running out of a running car. Like it's gonna happen because of the weight. And guess what else then happens? It interferes with both hormonal, like aromatase inhibitor medications, and chemotherapy drugs, which might now be a big reason why obese women have higher rates of recurrence and death from breast cancer.
Right. I was going to say, they're like, they're not responding. It might explain why some people don't respond as well to chemo as well as other people. So I wanted to ask you about menopause and estrogen and hormone replacement therapy, especially for some high risk women. There's been a new study talking about how hormone replacement therapy can be safe for people who are at high risk for cancer. It just, more of a contraindication if they themselves had breast cancer, but it just seems like a tricky thing to introduce if somebody's high risk for cancer, is estrogen. What do you think?
I think it's tricky. I think it's nuanced. I think it's not understood completely. So if you're breast cancer patients, do you really want to be an N of 1 and risk it?
Or if you're at risk, if you know you have the BRCA gene or family history, like, do you risk it?
I will let you make your own decisions, but I'll give you some facts. The more recent, so some people know about the Women's Health Initiative, but it's getting more and more in the rear view now. It came out in JAMA in 2002, but it was a pretty remarkable study in that they took 16,000 postmenopausal women and just randomized them to get that horse urine I mentioned in passing, Prempro, estrogen plus progesterone versus a placebo, a sugar pill, right? And they halted the study at 5.2 years for ethical reasons. They stopped it early. There was a 26% increase in breast cancer and the estrogen-driven cancers. Is that what you're saying?
Yes. The people who were given the hormone replacement therapy, they increased the risk they got breast cancer.
They did. And in that particular study, there were more strokes and heart attacks and blood clots and dementia. So this whole movement saying that it's cardioprotective and neuroprotective was not shown in that study, but there are others that show protection.
That's what I was going to ask you. That yes, there's some people saying you need estrogen to protect neurodegenerative diseases and heart attacks and strokes. So yes, talk to us.
Okay, and then what about people who have no uterus? They can supplement with just estrogen. They don't need the progesterone. The progesterone is there to break down your uterine lining that's built up by the estrogen. So if you don't have a uterus, you don't need progesterone. And what about those women? Do they have more cancer, less cancer, dementia, etc.? And the data on that is nuanced. So people like to just say, oh, the estrogen only arm of the Women's Health Initiative, which there was one, actually showed a drop in breast cancer risk. However, what the rest of the sentence is rarely noted, I noticed. Only in women who didn't take it for the first 5 years of menopause. When you're hot flashing your way to a divorce and need it, yeah. And not if you took it for more than 10 years total. So yes, estrogen only can be breast protective, but not if you take it in the first 5 years of menopause when you're wanting it, and not if you exceed 10 years.
And it also seems like, couldn't we just change our diet? Would that be more protective to just change your diet and exercise?
I know, right? It's so simple to say and difficult for people to do, and it's so easy to pop a pill. And it's easy for the doctor to prescribe. Okay, doc, I'm in. I'm going to go plant-based.
But I know people who were like, their cardiovascular doctor said, if you don't go plant-based, if you don't cut out the animal protein, you will have a heart attack and die. And those people do it. I see it.
So do my breast cancer patients. So let's not all wait until a pivotal life-threatening moment to make a life-saving choice. PCRM just came out with a study in November 2022 that showed that half a cup of soybeans a day versus placebo dropped hot flashes by 85% in 12 weeks.
I took blackstrap molasses in warm water for a month, cut my hot flashes by 80%, and I cut out alcohol. And when I wasn't drinking or angry, I didn't have any hot flashes.
Wow.
Isn't that amazing? Blackstrap molasses, which seems like such an old folk tale.
Okay, so one word about the menopause. So it's a tricky, individualized discussion with you. What are your symptoms? What are we really trying to manage? If the answer is like, oh, well, I just have crappy bones. My osteoporosis is getting worse and I want to be on estrogen for that. Oh, okay, but have we tried weight-bearing exercise and bisphosphonates? Like, there's other things to address. Depends what you're talking about. The most effective herbal that I've ever come across, so then we bottled it and bought it, so we own it. It's at Pink Lotus Elements. It's called Menopause Miracle. It's a 3-agent herb blend. It has 3 randomized controlled trials behind it, and in all the trials, women's symptoms were cut by over 90%.
Tell us what it's called, and we can find it on your website.
Menopause Miracle, and you can find it at Pink Lotus Elements, which is our online store. It's a women's health store. Everything in there is super interesting. It's very vetted when there are trials behind certain products that exist. But yeah, there's one for mood instability called Safrany that has great trials. And
right. There's other things that you offer to your patients if they're going through menopause. So I wanted to ask you about breasts. It's like taking us an hour to get here. I want to ask you about breasts, lymph flow, and breast density on mammograms that, radiologists seem to flag if somebody has dense breasts, or sometimes they have to have an ultrasound with their mammogram because it can hide cancer. But can you talk to us about dense breasts?
Sure. So breast density is measured visually, and now they have some computerized measurements of density available, but it's really just how white and splotchy does your mammogram look? And we grade it A through D. The A's have the fattiest breasts, and visually less than 25% of the tissue is white and splotchy. The rest of it is grays and blacks, as opposed to way over on the other end of our spectrum, the D's, 75 to 100% of the tissue that we're looking at on mammo looks like this bunch of white splotches. Here's the dual problem. Number one, cancer is white. So the denser your breasts, the whiter your mammo, the more we're looking for a snowball in a snowstorm, and we'll miss it. The A's and the B's are not dense. They have more fat and other tissues that are dark, so the cancers pop out more readily. But the C's and the D's, they have a between 20 and 50% chance of missing cancer when present. So those women, particularly if there's something else to uptick their risk, like a family history, a personal biopsy with atypia, genetic mutation, they need more than just a mammogram.
Like, what would you consider a 3D ultrasound, like the Sonoscine, or an MRI? And what do you think of the Sonoscine?
I love the Sonoscine. I love all of the automated ultrasounds. They are just great at evaluating the tissue in a different way than mammogram, because the cancers are now dark on the ultrasound and the breast stays white and gray. So it pops out better.
That's on the Sonoscine and 3D ultrasounds.
Yes, even on your typical
ultrasound. Okay.
The automated ones require less handheld expertise, right? The other ones are actually a tech. So there was a study recently that showed that if a doctor, an MD trained in ultrasound, obviously, is doing the scan, they are better at detecting cancer than automated. But automated is going to be better than just like a routine.
How do you speak to people about MRIs, and how often should people get MRIs if they're at high risk or if they've had cancer? Because I know one of my clients, she was having MRIs for 16, 17 years. And finally, now that she's in her 80s, her surgeon was like, you can stop doing it now. It's too much I'm saying it wrong. Gadolinium.
Gadolinium is required for a breast MRI to make any sense. It's not readable otherwise. So it's an IV injection of a heavy metal that one study in I want to say it was 2015, found in cadavers that the gadolinium pooled in people's brains forever. What it does there, we don't know, but it's clearly not an antioxidant. So we don't want to have excessive use of MRIs. So I have a judicious schedule based on a person's risk and based on their future plan. So someone who, let's go highest risk, BRCA carrier, but she is 30 and we're planning on prophylactic mastectomies at 38. She's going to get one every year. Her breast cancer risk is high enough to warrant annual screening, and I already know we're only going to do it 8 times. So it's probably the risk benefit goes toward benefiting annual MRI. On the flip side, if I have a woman whose lifetime risk of breast cancer.
But what do you do with somebody who's not going to do a prophylactic mastectomy, even if they have the BRCA gene?
So it depends on their family history. We basically, on either side, so let's say their mother had breast cancer at 50, then starting at 40, I'll do them every year. But if I'm talking to her and she's 22, I'll do them every other year.
So you want to sort of max out at 25 MRIs or something.
Yeah, no, the quantity isn't actually, no, but you're right. That's what I'm heading toward. I'm trying to minimize the number of MRIs you're getting, but still not go so long in between them that we've just went from a detectable stage 1 to, oh, it's stage 3C now. Sorry about that. So for our density thing, it's A through D. The C's and D's, if they have just dense breasts, I like to add whole breast ultrasound through Sonoscine or another automated system or handheld, just screening ultrasound. In general, if they can plan their life well enough, I like to space it 6 months away from the mammogram just so the breasts are getting good imaging twice a year. If on top of the density we layer more risk from a family history or personal biopsy with atypia or some other reason, then we will also create an MRI schedule that just makes sense for that particular woman.
Amazing. Okay, now what do you think about immunotherapy?
It's the now and it's the future. It's amazing. Immunotherapy is a total game changer, particularly for our most aggressive, least curable subtype of cancer, triple negative. And we are seeing phenomenal responses to immunotherapy given in conjunction with chemotherapy before surgery. Up to 90% of the cancers, what cancer? They're literally gone. It's called the PCR, path complete response, which means when I go in to do your lumpectomy, the prior cancer is not there. They call it a tumor bed. They can measure there's scar tissue change where that used to be, like a ghost footprint, but it's gone.
Amazing. Yeah, immunotherapy is amazing. Now, obviously, I'm somebody who works with lymphedema patients. And I'm a big proponent of people massaging their breasts, like massage early and often, get that lymph moving. What do you think about massaging your breasts?
Yeah, why wouldn't you? No, breast massage. Yeah, of course, of course. Get it flowing, get it dumping into the main space where it can get filtered and cleaned out and come back again and pick up some fresh toxins.
Well, listen, you've taken so much of your time. I do want to ask you as we close out this segment, I could talk to you for another hour, so maybe we'll have you on again. I want to know, what are you excited about in 2023? What are you looking forward to? What's new for you? What's going on in your work?
Oh, thank you for asking that. I'm really excited about a couple of things. I have a summit every year, and it's called the Cancer Kicking Summit. It's in October 2021-22 in Palm Desert this year. And it is just such a sacred time of sisterhood and some good men. Many a husband might come. But it is a deep dive into the 10 trees that you must plant in your orchard of life to have the most fruitful, bountiful existence possible. And the eating tree is just a tree, one. So I have many.
I know we didn't even get into exercise, which is so important also. Go get her book. Go get her book. She's going to tell you everything we didn't have time to talk about. But go on. So tell us about the summit.
The summit is super fun and informative. I have an online recorded version that is 11 hours that you can get and download today and start watching, but it's all research backed. That's the amazing part of it. I've taken my 22 years as a breast cancer surgeon and distilled all the pearls of wisdom and the things I've learned along the way into really actionable, fun, exciting, empowering ways. Foods, it goes from everything from recipes to here are the apps that you can use for meditation to it's very practical. Like you're going to leave with okay, I have a bag full of life in here.
Yeah, we didn't even talk about stress and inflammation. Oh my God, we need to do a part 2. All right. So everyone will go to your website and they'll find you. Are you on Instagram?
At Dr. Kristi Funk, Dr. Kristi Funk.
Perfect. Now, to close out our segment, we like to do a inflow and out of flow.
Oh.
What does being in flow feel like to you?
Oh, peaceful with my hair blowing back.
I love that. And what do you do when you feel like you're out of flow? What do you do to get back in flow?
I recenter myself. I get on my bicycle and ride it to and from work every day. It's just 6 miles, but the ride home is uphill like this. It takes 43 minutes and 14 seconds as of yesterday. I'm getting a little faster. But actually that helps me process better. Obviously, I'm getting my blood pumping, but I feel like the blood is then also de-stressing me and helping me the process. What really matters? You have to distill everything right down into, isn't it, if anybody's married out there or just in any relationship, right? Is this really a game changer? Am I really going to pull out blazing fires here? I think no. I think whatever is stressing me out, keeping me out of flow, needs to be put into a different perspective so that I can just magically get back in flow.
Thank you for saying that. I want to close on your book, the intro. Sheryl Crow was mentioning how what she's seen with people she's met, and I see this in my practice too, is people when they have a cancer diagnosis, there's a life perspective lesson shift where people start cleaning up certain toxic relationships or stress or finding joy and meaning in their life. And can you leave us with just a piece of joyful advice for anyone, even if they're not facing a diagnosis, but just sort of looking at their life and wanting to avoid dis-ease in the body?
I would say my one piece of advice to women with or without breast cancer is to practice forgiveness. You haven't done anything willfully that brought this, fill in the blank. It doesn't have to be breast cancer. It could be divorce, anxiety, depression, feeling lost, helpless, hopeless. Forgive yourself. You're allowed to be real and feel. What is not as forgivable is not owning this moment. So forgive the past. Take this, like Sheryl was saying, right? There's a BCAC, before cancer, after cancer, but it can be before and after anything. This moment of awakening. Use it to spring forward into a new you. Who said you have to be stuck the way you've been? Oh, she's depressed. She's always depressed. oh, okay, so she's not allowed to laugh and be happy now because she's depressed. Like, redefine yourself, ladies. Be who you want to be. Find out who you are with introspection and love and gentleness and prayer, and just really be there for yourself. Forgive others, because that's just angry and toxic and acidifying and inflammatory inside your body on a biochemical level. Know that you can think yourself into any state you want. When you think things, right? You're watching a scary movie, your heart's pounding, your palms are sweaty. Do you really think that something's going to come through your front door? No. Your brain is perceiving things that is making a chemical change happen. So your brain can go back in time to that argument, to that time you didn't do that right, to this thing that you failed, and it can bring up all of those same biochemical signals that make you fretful and anxious and regretful and miserable. Or you can think of the positive things. But going too far into the future isn't a good idea either, even if it looks rosy over there. You want to be present, right? That is always the goal, I think, of everything. You're doing one thing right now. One thing. Do it right.
You just made me, I just welled up with tears. That was so beautiful.
Huh?
And mic drop. Dr. Kristi Funk in the house, y'all. Woo! Thank you so much for being here. I really could speak to you for another 2 hours. I know you have a full day of clients, but thank you for being on and sharing your wisdom and seeing women as a whole. Everybody needs to listen to this episode, and I'm just so moved by you. I know so many people have been helped by you, and you just are so full of grace and hope and knowledge and wisdom. And I just wish you so many blessings as you continue this meaningful career. Thank you so much for being here.
Thank you, Lisa. My pleasure.
And you can find her at Dr. Kristi Funk on Instagram, and you can find her online at pinklotus.com.